about to lose my mind. One step away from the bread line.
Welcome to this week's episode of Unspoken Truths Trauma in the Black Community. I'm Dr. Laretha, and today we'll be discussing barriers to obtaining mental health treatment. For purposes of these discussions, the terms Black people, and African Americans are used interchangeably. Before I jump into this week's episode, let's recap episode 5 titled Mental Health Treatment Options. In episode 5, I was honored to be joined by my niece, Jalisa McCullough, psychiatric mental health nurse practitioner. Jalisa dropped some jewels. She shed some light on some of the mental health cases she encounters on a daily basis, which include anxiety and depression. She touched on stigma being a major barrier to treatment within the Black community. She also talked about our brain being an organ. And she stated that when we feel quote unquote off, we need to take action to correct it. Her insight on these areas was invaluable. If you missed episode 5 or any other episode for that matter, be sure to tap in because you never know how the information can benefit you or someone you know and or love. Episode 6 is focused on barriers to obtaining mental health treatment. The objective of this episode is to highlight the rates of use of mental health services by Black people, to identify some barriers to obtaining treatment, and to discuss alternatives to make sure you get the support that you need. So let's begin with the use of mental health services by Black people. Just so you are aware, the rates of use of mental health services for Black people are less than half the rates of the usage for whites. Yep. According to the American Psychiatric Association, 1/3 of African Americans diagnosed with mental illness will ever receive professional treatment to address it. This means 67% of the Black population are walking around with an untreated mental disorder. That's major. Take a minute to think about the implications of this. Now, I touched on this in episode 4, but I want to reiterate that this is highly concerning, especially when they may have multiple disorders going on at the same time. Pretty scary. Now, let's talk about why. So, what's preventing them from getting the treatment? Why is this? Why would anyone want to walk around untreated, knowing that it has a negative effect on their ability to function as normally as possible? Let's talk about it. There are several barriers that prevent us from either seeking or receiving timely and effective treatment. But one of the biggest barriers to mental health care is the stigma associated with mental health conditions. And that's, again, one of the things that Jalisa touched on last week. And this is predominantly true for the Black community. In addition to stigma, there are other barriers that include direct costs, such as lack of insurance, where they may be unemployed or ineligible for insurance due to part-time or per diem status. You could have high out-of-pocket costs like deductibles and copays, or insufficient income to cover the cost of premiums, which in some cases have increased more than 30% in the past couple of years alone. They may have limited access to transportation. Maybe they're on a bus line or not on a bus line. Maybe they don't have a vehicle. Maybe their vehicle is down. Maybe they're relying on other people to help get them back and forth. Whatever the case may be, it's a barrier. Then you have low to no income, which creates an economic strain for those who are already struggling to make ends meet, especially if they're living on a fixed income. With the cost of food, rent, gas, utilities, and other necessities, we know the struggle is real at times. Another barrier to care is access to quality care like safe care, where doctors make sure precautions are taken to avoid causing harm to patients, or effective care, where they provide open and honest information, using their expertise that will benefit the patient instead of dismissing their complaint. Then you have patient focused care, in which they respect patients' input and involve them in decisions that impact their livelihood. You then have timely care, where they provide referrals to specialists to eliminate delays, which can be a make or break situation depending on the severity of what the issue is. Then you have equitable care, where everyone receives care that is fair and consistent despite their race, gender, or socioeconomic status. Then we have systemic racism, which we talked about quite a bit in episode 3. And we mentioned the Tuskegee syphilis study, which denied treatment to Black men. So if you missed that, you want to go back and catch that. These types of disparities can lead to a worse health outcome for Black people because it creates a fear of discrimination or bias when they go to seek treatment. Then we have a lack of culturally competent providers who don't necessarily understand, respect, or incorporate a patient's values or belief into their care. This can cause a misinterpretation of cultural expressions, which can then fail to address racial and intergenerational trauma. This can then in turn lead to a misdiagnosis, ineffective treatment, or no treatment at all. This is why advocating for yourself is vital. Then we have a mis or underrepresentation of Black mental health professionals. We know that there's a shortage of providers who specialize in working with people who suffer from historical and or intergenerational and racial trauma. When we look at the statistics by profession, Black people make up 5% of psychologists, 11% of professional counselors, and 22% of social workers in the US. What's more disturbing about this is that these statistics are significantly lower than the total Black US population, which is hovering around 14 to 15%. It's sad. Last on my list are cultural barriers. There's faith and spirituality. And this is when Black people tend to rely on their faith and spiritual beliefs to address health related issues instead of seeking medical or formal psychotherapy. Then you have this notion of seeking help is a sign of weakness. Black people are reluctant to seek professional help due to concerns about the fear of being labeled crazy or dangerous. In addition, some believe that being strong means they don't face mental or emotional difficulties at all. Now, we got to be honest with ourselves because I've yet to meet a person who has not endured any form of stress or trauma. Then there's confidentiality. What I refer to is what's said or done here must stay here, which is a major concern. Black people do their best to keep personal issues a secret. But what we fail to realize is that these secrets manifest in ways that can be detrimental to our health. Or they may feel that they don't even need treatment. So unless it's a crisis, it's not bad enough where they feel that they need to seek treatment outside. Instead, we got to get to a point where we are proactive versus reactive, because by the time we reach crisis mode, it might be too late, a day late and a dollar short. When we think about these cultural barriers, what we have to keep in mind is, yes, these are things that we grew up on. These were the beliefs that were passed down from the generations that came before us. But what you have to keep in mind is, depending on the severity of whatever it is that you're dealing with, adhering to these cultural norms can make the situation worse. So be mindful of that. And if you feel you need to go get help, go get it. While there are several barriers, and we talked about them, when it comes to obtaining care, no barrier is too difficult to overcome, nor should it serve as a deterrent from seeking the support that you may need. Now, Let's talk about some alternatives to make sure you get the help you need. I realize that these alternatives may not work for everybody, but the point here is to provide alternatives that may help you overcome some of the challenges that you're dealing with. The first one is to seek out culturally competent providers. And so you may ask, how do I do that? Well, look for therapists who specialize in working with Black communities. They may mention racial trauma or African American mental health in their practice. Some examples of this include therapy for Black girls or inclusive therapy. Be sure to check out the links that I've included in the description because there's a lot of information that you may find to be beneficial for you. You can also explore community and faith based resources. We know that the Black church is often the first responder and, in some cases, the only responder. So, this might be a great starting point. This is especially important if they have a partnership with mental health professionals or even if they have their own internal mental health program. Mobile clinics, that's another option where they have healthcare services are provided from a vehicle and offer convenient access to medical care and are in various locations. So it's not limited. You have a number of different locations to access this. They also have sliding scale and low cost options where some therapists may offer sliding scale fees for those who don't have health care insurance. They what they typically do is they adjust the cost of the services based on a patient's income, their family size, as well as other financial factors. There are also community-based mental health clinics such as locally Strong Ties, which is right here in Rochester, in the Rochester, New York area. Another option is teletherapy or virtual support, which can be done virtually via platforms such as Zoom or Teams. This method would allow someone to connect with a mental health professional even outside of your local area, which offers a wider range of providers. You have insurance and Medicaid transportation programs. I mentioned earlier that transportation can be a limiting factor in people getting the help that they need. So you have free or discounted rides to appointments via Medicaid. Then you have support from family or other networks. Again, aligning yourself with people who you trust. And again, I don't use trust lightly. So whether it's a family member, a friend, or a neighbor, but please keep in mind that it's okay to ask for help, especially when you need it. I want to provide a disclaimer because I have no affiliation with any of these organizations or programs that I referenced. I simply gathered information to share with you or anyone who could benefit from it. So take what works for you and share accordingly, only if you choose to do so. Whatever the situation, you must advocate for you. You can't be afraid to ask questions about matters that pertain to you, especially when your life depends on it. If you don't prefer medication, ask about alternative treatments that don't require you to use medication. Request providers who are relatable and understand race based trauma. If you know that you will be overwhelmed when you go to these appointments, bring along someone you trust, someone who can serve as an additional set of ears to make sure that you don't miss anything that may be important. I talked about this in previous episodes, but you can also explore self help options such as journaling or meditating, talking with people you trust, as I just mentioned, engaging with peer support groups, or engaging in storytelling or collective healing circles. We have a number of those around. Again, barriers should never be a showstopper when it comes to getting the treatment you need. Remember, if you don't love yourself enough to seek help, nobody else will. So, to recap, I highlighted the rates of use of mental health services within the Black community. I identified some key barriers to obtaining treatment. And lastly, I provided alternative methods to overcome some of these barriers. Barriers to obtaining mental health treatment is real. I realize that this was a lot of information to digest, but my hope is that you found this information to be helpful, whether it be for you or someone you know and or love. This wraps up this week's episode. For your convenience, I included several links in the description in case you're interested in learning more about this topic. In closing, I want to thank you for joining me for another episode of Unspoken Truths Trauma in the Black Community. Remember, your voice matters, your healing matters, and together we will rise. If this week's episode inspired you, or if you know someone who can benefit from the information that was shared, please like, share, and subscribe so we can continue to have these important discussions. It's important to understand that no one should ever feel as though they have to walk this path alone. With the proper support systems in place, we will rise above all of the adversities caused by trauma. Join me next time as we continue speaking the unspoken and healing the unseen. Remember, self care is an essential step to healing from trauma. If you need help, go get it. Until then, stay strong and stay rooted as we continue to break generational curses one person at a time. Thanks for watching. Don't forget to like, comment, subscribe, and share.